Good morning, everyone. Today, I'll be presenting on the assessment of foveal avascular zone area changes after trabeculectomy in glaucoma patients using OCT angiography. Foveal avascular zone is a round capillary-free zone within the macula, which is conventionally assessed using fundus fluorescein angiography, which is an invasive investigation. New modalities like OCT angiography, which is non-invasive, can also be employed to assess foveal avascular zone. Now, OCTA-based FAZ area changes may be candidate biomarker to study changes in perifoveal microcirculation following glaucoma surgery. An enlargement of FAZ area is indicative of retinal ischemia, and a decrease in FAZ area is indicative of an improved retinal perfusion. There is only limited evidence on the effect of intraocular pressure reduction by trabeculectomy on FAZ area and foveal microcirculation, especially in case of primary angle closure glaucoma patients. Our study aims to assess changes in FAZ area in both primary open angle and primary angle closure glaucoma patients following trabeculectomy using OCT angiography, and also to correlate these changes in FAZ area with changes in IOP, foveal sensitivity, and visual field mean deviation. This was a prospective observational study which happened for a period of 1 year in Glaucoma Department of Contrast Eye Hospital, Calicut. We included patients with primary open angle and primary angle closure glaucoma who had clinical indications for phacotrabeculectomy. We excluded patients with ocular pathologies that could bias the FAZ area, such as diabetic retinopathy, vein occlusion, macular edema, ocular trauma, uveitis, and also trabeculectomy with complications and poor quality scans. A proper detailed history, anterior and posterior segment evaluation, IOP measurement using Goldman applanation tonometry, gonioscopy, HFA24-2 and OCT-RNFL, and OCTA was done. OCT angiography was done using Heidelberg Spectralis HRA to assess the FAZ area both pre-operatively and 3 months post-operatively, both in superficial and deep vascular plexus. The area was measured by tracing the inner loci of the capillaries by 2 examiners independently, and the mean value was taken. Coming to the results of the study, the total sample size was 41, with 23 primary open angle glaucoma patients and 18 primary angle closure glaucoma patients. So around 70% had severe glaucoma. In primary open angle glaucoma group, the intraocular pressure decreased from 22 to 15, and in angle closure glaucoma group, it reduced from 23 to 15. The mean change was 7, and this was statistically significant. Coming to the FAZ area changes in the superficial vascular plex. Both in primary open angle and primary angle closure glaucoma group, there was a change, but this was statistically significant only in the open angle glaucoma group. Coming to the change in FAZ area in the deep vascular plexus preoperatively and postoperatively following trabeculectomy, there was a statistically significant reduction in both the groups, and the change in open angle group was 0.073 and in angle closure group was 0.053. The correlation between change in intraocular pressure and change in FAZ area in the superficial vascular plexus was weak, negative, and not statistically significant in the superficial in SVP. The correlation between change in FAZ area and change in IOP in the DVP was not statistically significant for the primary open angle glaucoma, but in PACG, there was a negative correlation which was statistically significant. Now, the correlation between change in FAZ area and foveal sensitivity was a weak positive correlation. Also was the case with HFA mean deviation. So our study had a sample of 41 for duration of, we assessed patients for duration of 3 months, and we found FAZ area was decreased both in SVP and DVP in both PACG and POAG patients. A study by Takui et al. Says FAZ area was decreased in SVP, and by Haeyang et al. Says there was significant decrease in FAZ area in DVP. Another study by Tu Wang et al., they said there was an increase in FAZ area at 1 month, which decreased in 3 months, but reverted back to baseline at 1 year. So conclusions, foveal avascular zone area in both superficial and deep vascular plexus was decreased after combined cataract and trabeculectomy surgery in both PACG and POAG patients. The significant reduction in IOP and the associated changes in FAZ area suggest that trabeculectomy may improve retinal perfusion. So the study strengthens the understanding of how lowering IOP with trabeculectomy affects retinal vascular health by employing a non-invasive modality, and also it highlighted the differential vascular response in SVP and DVP. The values might have been influenced by cataract extraction done along with trabeculectomy, and patients were followed for a shorter duration, and FAZ area was manually traced. And stoppage of anti-glaucoma medication post-surgery could have also affected the values. Thank you.
So yeah, thank you. So was the sample size adequate to take this determination? And what was the duration of the glaucoma prior to this? Did that make a difference? Did you look at that? Because
Is it duration of?
Glaucoma.
of the
Duration
glaucoma
of the
itself,
disease.
right? The
Yes,
changes to the SVP, DVP would also depend upon.
Yes, sir.
Yeah.
And also the follow-up period was like we are actually continuing the study. Like we could get the results for only 3 months. There was a study which showed that at 1 year, the result had actually the FAZ area had gone back to the baseline. So we are yet to derive results out of that. Like these are only the results of 3 months follow-up actually.
Yeah, but I think the study needs to be a little better powered in terms of the sample for this. If you looked at all the other studies, the sizes are much
So
bigger.
could you correlate the FAZ area reduction improvement post IOP control with the visual acuity improvement? Because that's what the patient is bothered with. How much is the vision improved? I assume IOP was controlled for all. So what was the visual acuity improvement if the vascular perfusion had improved? Did the vision improve?
Actually, it was not. Actually, we had 70% of the patients falling into the severe glaucoma category.
Right.
So the improvement in vision was not that significant. The improvement could also be due to the cataract extraction, which had happened along with the trabeculectomy.
So what was the clinical implications of the improvement in the FAZ area? Vascular permeability. Any clinical implications?
One thing is like an advantage for trabeculectomy because a sudden decrease in intraocular pressure, which was not possible with maximum anti-glaucoma medication. This could have improved the ocular blood flow and the ocular perfusion pressure, so thereby increasing the perfusion to the retina. So it's advantageous in terms of vascular supply to the retina.
So how did you assess that? Other than FAZ area, any other thing, visual field or visual acuity or contrast, anything which improved?
We didn't
It's
get
okay. Any other
correlation.
questions from the house?
One question. The lenticulopacities are known to affect the FAZ area, and you have done phacotrabeculectomy in all the cases.
Yes,
Do you
sir.
think that will affect the result outcome?
Yes, sir. That's a confounding factor
It's a
actually.
big,
It's a very significant confounding factor.
because
in
your
study.
topic says after trabeculectomy, but your reading says that it is after phacotrabeculectomy. Because after phacotrabeculectomy, there can be more inflammation and
Yes, sir. It could have affected
and the
FAZ area.
duration after which that you have done an AIOS2025 to see the FAZ area is also important. That how long after your surgery would you be doing that? So you said all were it's a 3-month study.
We evaluated
So
at
I
3
don't think
months only.
all the cases were done at one time and after 3 months you did a FAZ.
no,
Yes.
the longer
it could
follow-up
have
will
been
tell, I think. once
slightly
you-
longer till the time you could see what the effect is.